More than 1 in 2 people on Medicare are enrolled in a Medicare Advantage plan. But here's the problem. Starting in 2026, over 1 million of those plans are going away. If you don't prepare, you could lose your coverage, your doctor, and even your prescription benefits on January 1st. In this video, I'll explain 3 things. 1. What's happening with Advantage plans? 2. Why it's happening? And 3. What you can do to protect yourself. What's happening? Big insurers have already announced they will be cutting Medicare Advantage plans in 2026, and the impact is huge. Over 1 million people will lose their current coverage. United Health Group, the largest insurance company in the nation, said it will eliminate plans affecting more than 600,000 members, mainly PPO plans. And they aren't the only ones making changes. Other insurers are also scaling back. Here's what makes this especially important. If your plan is canceled, you will not be automatically moved into another one. There's no rollover or crosswalk. If you do nothing, you'll end up on original Medicare alone, with no prescription drug coverage and no cap on your out-of-pocket costs. This is particularly concerning for people on PPO Advantage plans. PPOs allow more flexibility with doctors and specialists, even out of network in some cases. But that flexibility makes them costlier for insurers, which is why PPOs are the first plans being cut back. And these cuts are happening at the same time Medicare costs are rising. Part B premiums are projected to increase from $185 to more than $206. Part D deductibles are climbing past $600. Even small copays that feel manageable today could double or triple in 2026. Why is this happening? The short answer is money. Healthcare costs are going up faster than inflation. More people are seeking more care than in the past. And new rules from the Inflation Reduction Act have shifted larger prescription drug costs back onto insurers. At the same time, many insurance companies are facing lawsuits, especially around the use of prior authorizations and even artificial intelligence to deny claims. All of this is cutting into their profits. Remember, these insurers receive thousands of dollars per Medicare Advantage enrollee each year from the government. They are required to spend most of it on medical care, but when profits shrink, they aren't the ones who take the loss. Instead, they cut plans, reduce benefits, or raise what you pay. That's why 2026 isn't just another year of small changes. It's a major reset, especially for anyone who depends on a Medicare Advantage PPO plan. What you can do: if your plan is eliminated, you still have options, but you must act before the deadlines. Option 1. Choose a new Advantage plan. You can stick with your current insurance company if they offer a replacement in your area, or you can switch to another provider. But don't assume a zero-premium plan is automatically the best deal. What looks free up front can come with much higher costs for hospital stays, specialist visits, or even basic services like x-rays once 2026 begins. Option 2. Switch to Original Medicare with Supplement. Normally, Medigap supplement plans require medical underwriting, and you could be denied if you have health issues. But if your Advantage plan is canceled, you gain what's called a guaranteed issue right. That allows you to sign up for certain Medigap plans without answering medical questions and without being turned away. If you've ever been denied before, this may be the best chance you'll get to make the switch. Option 3. Pay close attention to the deadlines. The standard Medicare open enrollment period runs from October 15th through December 7th. But if your plan is canceled, you have until December 31st to pick a replacement. Don't push it that far. Missing the deadline means starting the new year with no coverage at all. And remember, this isn't something you want to ignore. Watch for your annual notice of change letter in September. Compare your options in October when new plans are posted, and make your decision well before the December deadline so you don't get caught without coverage. You've paid into Medicare your entire working life. Don't let that money end up padding insurance company profits. Make sure it's working for you and your healthcare. Now I want to hear from you. Have you already gotten one of those Medicare notices, or are you worried your plan could be on the chopping block for 2026? Share your experience in the comments, because when we all share what's happening in our areas, it helps everyone make smarter choices.